Hey everybody, some of you all know that I'm a pharmacist. After my dad died, semi-retired, and everybody is a little uptight about Corona. And as a pharmacist, I thought it was my duty to speak about it and maybe educate my neighbors, my friends, and whoever's watching me. And so far, I've been using the CDC and WHO to get my information, plus TV, plus my own search. And as of yesterday, my information is up to date as of yesterday. The virus is named SARS, SARS /CoV/2. This disease has been named Coronavirus Disease 2019. They abbreviated COVID, COVID-19. So you'll hear the phrase coronavirus or you'll hear the phrase COVID-19, but they're both the same. It started roughly about December 10th in a city in China called Wuhan, Wuhan, and the province is Hubei, Hubei. It has paralyzed China, and maybe one of the reasons is to show his might, because of of God's might, I should say, because of the Chinese arresting 4 million, some people say even more, Uyghur, who are Turkish Chinese Muslims, just for the sake of, because they're Muslims. Okay, so they disrupted their life. They put them in concentration camps. They took away their kids. They raped their women, and all this, and the beatings and the killing of the men, all this because they were Muslim. Okay, so God got up angry. You don't do that to that many people and expect him not to say anything. So far, the World Health Organization, abbreviated WHO, has confirmed 125,000 cases in about 114 countries worldwide. That is why they call it a pandemic, because it's worldwide. China's leading the infected cases. Then Italy, we don't know why, but Italy is second. The United States, roughly about 38 states that are confirmed. And the problem with the United States is the testing. The testing was a complete failure. They had little tests. Instead of learning and asking China or seeking some help, hey, what did you guys do? Trump's administration comes on news. First of all, he said the corona is nothing, cold, a couple of days would go away. Second, he says everybody who wants to get tested shall get tested. That's a complete lie, okay? And the testing in the United States, one of the reasons why they are delayed is the first 100,000 tests that were made, they forgot a component, some type of testing agent. So the tests that they produced, it was given false readings. They might not tell you that, but it was on their website, and they call it a technical failure, but that's what the reason is. Now you also have Washington State, okay? It is the site of the largest outbreak in the United States. It's mostly affecting nursing home patients. And these people have not flu. And so they don't know where they picked up this virus from. So a lot of the nursing home patients in Washington State, I think one of them is called Kirkland, okay? And the funny part is there's a little town not far from New York called New Rochelle. 1 out of 5 that were affected in the United States came from the city of New Rochelle. They had one thing in common. They attended the AIPAC, which is the biggest Jewish lobby in the United States for Israel. And when they went home, they found out they were positive and they were affecting everybody. Even Senator Ted Cruz got affected, and some people on Trump's administration, but they keep it hush-hush. Okay, Governor Cuomo, my hat's off to him, worked quickly. He used the National Guard. They surrounded the city, nobody in, nobody out. They gave everybody help as much as they needed. They tested everybody. They even made a laboratory there, okay? And which is good. That's what you got to do, okay? This slow response from the Trump's administration, it's unbelievable. This is the United States. This is not a laughing matter. This is not a joke, okay? His slow response avoided kits and testing to be distributed to people who needed that. The hospitals were panicking. They were getting patients, but they couldn't do anything, okay? Also, the slow response from the Chinese government to tell officials, okay? That also affected or increased the people getting the virus in China as well. But now somebody says they have a hold. I really don't think so, okay? Now, studies have made, and they say this coronavirus comes from the SARS family. It's a beta coronavirus and the MERS, and the MERS virus. They all have one thing in common. They believe the origination is from bats, B-A-T-S. And that bat transmitted it to an animal. We don't know which animal, and that animal affected humans. And this is a theory that the scientists have. Now going back to the test kit that is used by the CDC is called CDC 2019 Novel Coronavirus Real-Time Reverse Transcriptase Diagnostic Panel. It's a mouthful. Okay, this test, now some people, you cannot expect to be tested like President Donald Trump says, okay? This test is going to be limited in the beginning to those who are definitely positive, those who traveled from overseas, senior citizens, and you're not only, if you're tested and you're positive, they're going to test you maybe 2 or 3 more times to see that it's eradicated from you. Okay, so there's going to be a shortage. Right now, I live in Ohio. Cleveland Clinic has the ability to do 500 tests a day, and by next week, it's going to be able to do 1,000 a day. That helps, okay? In terms of the vaccine, Trump says everybody will get vaccinated. It'll be ready in 3 months. That's a lie. Donald Trump, give the decisions to the people who know.
Impact or much of an impact on corona?
No, he's asking the question, when is it going to be deployable? And that is going to be at the earliest a year to a year and a half, no matter how fast you go.
You think that's right?
Anthony, F-A-U-S-T, is the director of the NIC. And he said specifically, testing have to be done, studies have to be done to see if it works, clinical trials have to be done. We will not see a vaccine for the coronavirus maybe 1 to 2 years. So I don't know what he's telling you. I think he's high on something. Okay. How is the coronavirus spread? When you cough and sneeze, the infected respiratory drops travel through the air. And if you're within 6 feet of a person and you touch, or the air goes into your nostril or to your mouth, it could affect you, okay? That is why they tell you sanitize, wash your hands. The prevention is very important, okay? Now, we're still collecting data and we're still collecting information on the virus. The virus can live on surfaces anywhere from 2 to 14 hours, and some people say days. They don't know yet, okay? Sometime, why do you catch how is this spread? Some people are asymptomatic, meaning that they might not have no symptoms at all, and you come close proximity to them and you get infected. Now, some people are symptomatic but do not self-quarantine, meaning if you go to the hospital and they'll tell you, hey, you got to stay in your house for 14 days, they don't follow the rules, they're not responsible, and they're walking inside the community and they're walking in malls. There might be teachers, they might be anybody. I'm not just using teachers. My daughter's a teacher. I don't want her to get upset. It could be anybody in the United States can be walking and symptomatic and passing it on. Follow directions, people. You got to be a little more responsible. Coming close to contact with, if you have it. And there's a lawyer, an attorney in New York, whose family were positive, and his neighbor wanted to do a favor and take him to the hospital, and he got affected. Okay. There's also community-acquired cases, like I told you, then where the origin or the infection is unknown, like the nursing homes in Washington. Now, what are the symptoms that you look for? The cardinal symptom is high fever, meaning 104 Fahrenheit and 40 centigrade. Difficulty breathing, persistent coughs. Symptoms may not appear at all, or you could experience some of these symptoms 2 days or may even take 14 days. But they say the second week is more severe. Now, older people and people with underlying health conditions, like health in terms of autoimmune disease, cancer, lung diseases, immune system diseases, these people are very susceptible and they have to take extra precautions. Okay. Now, what are the treatments? Okay. There is no magic pill that you could take and the coronavirus will get rid of. It's a virus. There's no cure for it. You have to treat the symptoms. Okay. Emphasis is on supportive care. Okay. If you had the symptoms, and you have to be your own doctor. You got to differentiate between regular cold, like I have right now. I do have a cold. I'm coughing a little bit, and I went to the emergency room twice, okay, out of fear because of the cough. And they said, no, it's just a regular cold, okay? The hospital is going to basically relieve your symptoms, okay? You're going to go to the hospital. If they're going to ask you if you have any pre-existing conditions, if you have notice difficulty breathing, if there's any organ failure, that's what they look for. And right now, like I told you, just started to test in the United States. The tests are not available to all hospitals, and the hospitals are trying their best. But it's not up to them. The manufacturers are limited because sometimes the supplies come from China. Okay, now for the people in the United States, if you suspect that you may have it or you came in contact, do your own research. Call your local health departments. Okay, there's toll-free numbers for all local health. You could Google it. What's the health department phone number, contact information in your area, and they could help you, okay? If you go to emergency room, people, and if you don't have these symptoms, you're just going there out of fear, not only do you overburden the system, okay, and you waste a lot of time and money, but you're also, you're not going to be given a prescription because it's a virus, okay? You may be told to self-quarantine and stay home. They might give you Tylenol, the fever if you have it, and they tell you to hydrate yourself, okay? Not all people, I can't overemphasize this, not all patients with COVID or coronavirus